Hello everyone, I'm Jessie. In this video, we will see the muscles in the angle and foot complex. Muscles of foot. Dorsiflexion. Anterior to the talocrural joint axis, dorsiflexors are present. Tibialis anterior, extensor digitorum longus, extensor hallucis longus, peroneus tertius. Plantar flexor. Posterior to the talocrural joint axis, plantar flexors are present. Triceps surae, tibialis posterior, flexor hallucis longus, peroneus brevis, flexor digitorum longus. Pronator. Lateral to the subtalar joint axis, pronators are present. Peroneus tertius, peroneus longus, peroneus brevis, extensor digitorum longus, extensor hallucis longus. Supinator. Medial to the subtalar joint axis, supinators are present. Triceps surae, flexor hallucis longus, flexor digitorum longus, tibialis anterior and tibialis posterior. Peculiarity of angle muscles. The muscles of the angle joint are attached to two or more joints. Eccentric muscles of angle joint. It is divided into three compartments. There are anterior compartment, lateral compartment and posterior compartment. Anterior compartment. Tibialis posterior, extensor hallucis longus, extensor digitorum longus, peroneus tertius muscles are present in this anterior compartment. Lateral compartment. Peroneus longus, peroneus brevis muscles are present in this lateral compartment. Posterior compartment. Tibialis posterior, flexor hallucis longus, flexor digitorum longus, triceps surae muscles are present in this posterior compartment. Anterior compartment muscles. These muscles are strong dorsiflexors. The first muscle is tibialis anterior. Origin. Lateral surface of tibia and interosseous membrane. Insertion. Medial cuneiform bone, base of first metatarsal. Functions. It regulates the plantar flexion in the initial phase of gait. It is a strong supinator. Extensor hallucis longus. Origin. Middle third of medial surface of fibula and interosseous membrane. Insertion. Base of distal phalanx of the great toe. Functions. Regulate the plantar flexion. Weak supinator. It is an extensor of big toe. Extensor digitorum longus. Origin. Proximal half of medial surface of fibula. Lateral tibial condyle interosseous membrane. Insertion. Distal and middle phalanges of digits 2 to 5. Functions. It is the extensor of MTP joint and interphalangeal joint. It is the everter and pronator of subtalar joint. Peroneus tertius. Origin. Distal anterior surface of the fibula, also the interosseous membrane. Insertion. Dorsal surface of fifth metatarsal. Function. It is the everter and pronator of subtalar joint. Pathomechanics. If there is a weakness of all of these muscles or 2 to 3 of these muscles, there can be foot drop. If these muscles are tight, the opposite movement is limited. Lateral compartment muscles. Lateral compartment muscles are peroneus longus and peroneus brevis. Function of these muscles are plantar flexion, pronation and eversion. These are weak plantar flexors and strong everters. Peroneus brevis. Origin. Lower two-third of lateral fibula. Insertion. Fifth metatarsal. Function. It is passes from the infrolateral surface of the fibula and descends with the peroneus longus and attached to the fifth metatarsal. Peroneus longus. Origin. Originating from the superior and lateral surface of fibula and the lateral tibial condyle and descends downwards, passes underneath the transverse arch. Insertion. Inserts into the medial cuneiform and first metatarsal. Function. Compared to peroneus brevis, peroneus longus having greater capacity of torque generation. Biomechanics. It is a plantar flexor, everter and pronator of the first metatarsal. Transmit weight from the lateral to medial side. Peroneus longus maintains the center of base of support. It helps pronation twist of the metatarsal joint. Pathomechanics. Weakness of the peroneus longus and peroneus brevis can provide restriction in inversion and pronation. If the tightness seen in peroneus longus, it will lead to excessive plantar flexion. It produces callus formation in first metatarsal. Callus is a bony growth caused by excessive weight bearing. Weakness of peroneus brevis can be reduced the balance between inversion and eversion. The next video we will continue the muscles in the angle and foot complex. Thank you.